Vaccine hesitancy is an issue across many communities as we try to reach herd immunity.
Healthcare workers are partnering with pastors, doctors, nursing associations, and everyday citizens to educate communities on COVID vaccine safety.
As WPTV News Channel 5's Tori Dunham reports, here in Palm Beach County, there is an orchestrated effort to get Black communities vaccinated.
Try to be ahead of the curve.
Dr. Tony Drayton walks the streets of Riviera Beach.
I walked out down the street and began to talk to folk that look like us.
He's the pastor of St. James Church.
There's a hesitancy of taking the vaccine.
Do you feel like this is part of your job as a pastor?
We have a moral and an ethical obligation to be as safe as we can.
As a pastor, yes, because it's a part of what we do as we service humanity.
On a mission to educate and inform about COVID vaccine safety.
I certainly understand the lack of trust of government and political system among Black and brown people. Our history gives credence to that.
Dr. Drayton points to another turning point that escalated already present skepticism. The pause in the Johnson & Johnson vaccine, is that something that you think is really going to affect Black communities?
Oh, definitely, yes. Incontrovertibly, yes.
That stopped you in your tracks.
Yes, it did.
We've been oppressed, we've been marginalized, we've been disenfranchised as Black and brown people of our community. But now we need to get the information out of the importance of right information.
It's an issue that the T. Leroy Jefferson Medical Society is taking on. The group of healthcare professionals focuses on underserved communities in Palm Beach County.
Especially since Johnson & Johnson, we've got to, make up a little ground because I think we lost a little ground on, some of our outreach efforts and things like that around the vaccine with people of color.
Outreach efforts now amped up to deliver a simple message. The vaccine is safe and effective.
I ran into a 13-year-old who told me that her family was afraid to get the vaccine because they thought they would die if they got the vaccine. And so we're trying to change that messaging.
Public service announcements, bus wraps, word of mouth targeting specific family members.
We have programming specifically targeting moms who are pregnant right now, but just in general, we find that moms are doing the shopping in families, and then also they help make those health decisions, and they're the ones who will say, hey, you need to go to the doctor to dad or the kids. So they really hold a lot of power in the family.
They believe there's also power.
And I had to say my goodbyes over FaceTime to my father.
In personal stories.
I don't think I necessarily understood all the way how serious it could get.
22-year-old Terrell Seabrooks from West Palm Beach now works with T. Leroy Jefferson Medical Society to share his story.
Those percentages that we hear about, and we talk about how rare it is, it became a reality for me on August 26th when I lost my father to complications with COVID.
Turning pain into purpose.
One of the happiest days of my life was followed immediately by one of the hardest days of my life. The last conversation I had with my father, the last real one I had before he was admitted to the hospital, was to tell him that I had been accepted into law school.
Now, before he heads off to Harvard Law, he's spreading a message of love through vaccination.
The impact that it can have on a family is devastating, so it's about really helping our community understand that getting the vaccine is necessary, and he definitely would have wanted me to speak out about this issue, and he definitely would be proud, I hope, of the work that I'm doing as well. I know he was proud, when he was here.
Canvassing is a big part of this campaign. That's where Malcolm, who lives in Riviera Beach, comes into play. Malcolm is a canvasser. What are you out here doing today?
Well, basically, I'm going door to door, knocking on doors to make sure, urging people to stay safe during COVID, knowing that there's vaccines out, but we still have information as well as some masks and sanitizer to make sure everyone is still safe.
This afternoon, Malcolm says he's going to be hitting this neighborhood here in Riviera Beach.
Well, we handing out this stuff in the community.
All right, thank you, appreciate it.
Do you think this is effective?
Yeah, I believe it's very effective. A lot of people in the neighborhood like interaction, face-to-face interaction.
What's your name?
Malcolm.
Yo!
Knowing that I'm able to see them face-to-face and tell them these things, now they're able to ask questions that they have.
There's a general sense it's that human interaction, real stories from trusted individuals that matters.
Thank you so much.
We are an organization of women of color and we go out and educate.
Rashawn Ridley McCrae is the head of the Palm Beach County Black Nurses Association.
The main thing is educate, educate, educate.
The infectious disease nurse practitioner says the hesitancy is real.
It's a big problem. It's a big problem, but it needs to be solved, and I think it can be solved. What I'm hearing from people is they are scared. They don't want to get blood clots. They don't want to die, and they don't know the long-term effect of it. I just let them know I got vaccinated in January. I had no issues with it since I got vaccinated, and they can look at other people in their family as well too.
It continues to affect, disproportionately, African American and Latino populations in Palm Beach County.
Dr. Katanga Camino,
you may get some injection pain.
An infectious disease specialist, says younger patients are coming in.
We're really worried about the younger people. They're the ones that are out and about.
Tackling the complacency is not so simple, he says.
When someone comes and says all of a sudden, well, we're going to go ahead and just ask you to go ahead and get vaccinated, because of our lack of healthcare, because of our knowledge about science, or our knowledge about how this whole medical system works, or the lack of people that look like me telling them that it is a safe vaccine. When those things aren't in place, I think that's when you get this hesitancy.
Now being confronted on multiple fronts in an effort to turn that hesitancy into herd immunity. Tori Dunnan, WPTV News Channel 5.